Good evening and welcome to tonight's edition of Fact Sheet live on ETV, live on Facebook, Twitter and Instagram. Our handle is ETV Ghana. Also live on Nisim 95.9 in Bogotanga and 100.1 in Tamale. You're welcome to tonight's conversation, and tonight we're talking about a health-related matter that's become a matter of concern for most Ghanaians and the world at large. We are discussing the Marbec virus. In June, the Ghana Health Service prompted Ghanaians that they had recorded 2 cases of a suspected Marbec virus situation in the country. And so Ghanaians keenly followed to find out whether it would be authenticated that this was a Marbec virus we were dealing with, or it was another disease we were dealing with. Just yesterday, we got a report that 2 individuals, that's the 2 cases which had been reported previously, these individuals had died, and that some 90 people had been contact traced, and that the Ghana Health Service was checking the situation. The international media picked up the story, and these were the headlines that were making the news yesterday that I'd like to share with you, our viewers, tonight. Al Jazeera reported Ghana declares first outbreak of highly infectious Marbec virus. BBC said Ghana confirms first cases of deadly Marbec virus. Other websites such as the Washington Post also reported a deadly virus was just identified in Ghana. What to know about Marbec, and also it's also there. And then CNN also reported Marbec virus. Ghana confirms its first outbreak of the deadly virus. So the world is concerned, but are we as a nation concerned? And what do we know about this virus that we are told is a deadly virus which has the potential of a fatality rate of between 24 and 88%? What do you know about this disease? Are we seeing any signs of pragmatism on the part of the Ghana Health Service to ensure the people are not taken by surprise in terms of the spread of the disease? What education program are they going to outline to ensure that this disease does not spread? Remember, when COVID-19 broke in China, the world started treating it as if it was going to be a situation only in China. But we are all suffering from the impact of COVID-19 today. We are told this disease has the same symptoms as that of Ebola. So tonight we'll speak to the experts to give us some explanation as to how this disease is transmitted, as to how dangerous it is, and whether we have the facilities to combat that. What we should look out for and the things we must do. And so that will form the basis for our conversation tonight when we are talking about the Marbec virus. My name is Samuel Ishen, and I welcome you to tonight's conversation. We'll take a quick breather. When we come back, our guest will be introduced to you, and then we'll delve into the matter. Do kindly stay with us. And welcome back to Fact Sheet live on ETV, live on Facebook, Twitter and Instagram, also live on Nisim 95.9 and 100.1. And we encourage you to follow the conversation with your thoughts, your views and your comments. And if you have any questions at all, you can ask me via Facebook link or even via Twitter, which is ETV Ghana, and I'll throw your question to my guest who will be joining me shortly. But for now, I would want for you to watch this clip before we start the conversation.
Ghana on Sunday confirmed an outbreak of the Marburg virus disease, a hemorrhagic fever almost as deadly as Ebola, after blood samples taken from 2 suspected cases tested positive. It is the first time the disease is being reported in the West African country. Last week, samples from 2 people in the southern Ashanti region suggested the Marburg virus and had been sent to the Pasteur Institute in Senegal for confirmation, the Ghana Health Service said in a statement. Dozens of people identified as contact cases are currently under quarantine, the service added, noting that no new cases have been detected so far. The Marburg virus is transmitted to humans by fruit bats and is spread in humans through direct contact with the body fluids of infected people or with surfaces and materials, according to the World Health Organization. Previous outbreaks have occurred in Angola, Uganda, the Democratic Republic of Congo, and Guinea.
And you're welcome to the conversation. Some brief information about how the news is being reported out there about the outbreak of Marburg virus in Ghana today. And so in welcoming you, again, I remind you that you can enjoy the conversation with your thoughts, your views, and your comments. Tonight we are joined via Zoom link by Dr. Peter Kojo Kwashi, who is a Senior Research Fellow at WACBIP, and Dr. Joseph H.K. Boni, who is a Senior Research Fellow, Noguchi Memorial Institute for Medical Research, University of Ghana. To join me for us to have an understanding and appreciation of the disease and how we can combat it with these reported 2 deaths all as a result of Marburg virus. Gentlemen, good evening and thanks so much for joining us tonight.
Good evening and thanks for the opportunity.
Good evening, and good evening to your listeners also.
All right, so I will start with you, Dr. Kwashi. What is the Marburg virus?
So Marburg virus is a filovirus. It's in the same family as Ebola, and it's what we call, it causes viral hemorrhagic fever. So that means that you're going to have a lot of bleeding, internal bleeding from orifices. So, and it's a rare virus. It's a rare, compared to Ebola, it doesn't tend to cause human outbreaks, but when it does, it's quite deadly, and you do see a lot of these manifestations.
So where does this virus come from?
The preponderance of evidence suggests that it resides in bats or other, mostly likely bats, fruit bats, and somehow when the chance comes together that humans and these bats are in the same vicinity, or maybe from eating contaminated fruits or something, then you have this crossover into the human population.
All right, if you can you give us a history of this Marburg virus? How new or recent is this virus, and how long has it been with us if it's not that new?
So the date escapes me, but the first cases, actually Marburg is it's a city in Germany where they first identified this virus in bats from a cave in that city. And so it was named after, in the past we used to name viruses and diseases and bacteria after the place where they are first identified. And then later on they identified that it's present in, I think this was, the first identification would have been in the 40s or 20s. 1948 keeps coming back, but maybe Dr. Bunny will have the exact date. And so there's been sporadic crossover events, mostly in the Congo, and it has not, similar to Ebola, it was not really reported in West Africa until I believe 2021, where it was reported in Guinea in one person, and that person died. And this is the first time in Ghana in these 2 individuals.
All right, so Dr. Boni, let me come to you if you're able to help us with some history about this disease, the Marburg virus, how long it's been with us.
Right, so thank you. So my colleague was spot on. Actually, it was in the year 1967 that they found these. They first detected it in Marburg, that is the city in Germany. But it was actually from what we call the green monkeys. You see, green monkeys that were imported from Uganda into that country for certainly some scientific experiments, and they realized that they were dying. So after they screened them, they realized that they had this virus. And like what my colleague said, because it was first detected in Marburg. They gave it that name, Marburg virus. So it was actually in 1967 that this happened. So thereafter, then we had outbreaks like you indicated in your intro, outbreaks in DRC, that's the Democratic Republic of Congo, as well as Uganda, where we had notable outbreaks where we close to a little over 200 people died. So basically, that's a bit of history on the virus.
Now, give us a sense of how this virus operates within the human system. If it's transmitted from a bat into a human being, how does it operate in the body?
Yeah, so if you have a full-blown infection, what it means is that these are viruses that has the ability to destroy your, we call it, vascular system. So the tubes that will carry your blood across the body or from the heart through across, so they have a way of puncturing through these tissues, these tubes. So you have bleeding, so bleeding diathesis, and the bleeding can be internal as well as coming out of major orifices in the face and also on the body. So you can have this through the nose or nostrils. You can bleed even through your tears will be bleeding and all that. You have bleeding in the gums and all that. So basically that's what it is. And you know, because the virus operates by destroying this vascular system, if you are taking a sample for testing, you don't need to more or less use a needle to take a sample from a vein, because what the virus does is it compromises your clotting factors. So you tend not to clot. If you start bleeding, it's not easy for you to stop bleeding. So the moment you start using needles on somebody who is suspected to be having this, you rather let the person bleed to death. So advisably, if you are taking a sample from the person is vomiting blood, the person is having blood coming from all orifices, so you can take these as your samples, not going to punch with a needle. So that is how basically the virus works in the body.
Now, what's the mode of transmission for the virus, whether it's from human to human or from an animal to a human?
So my colleague was explaining that very well. So you know, it's been found that the bat that we call is one of the fruit-eating bats, Egyptian rosetus. So it's been found in them some years back. They're quite a credible evidence that they are the vectors of these viruses. In other words, they harbor this virus, and you don't see any clinical signs on them. But when it spills over from them to humans, then it becomes deadly. So from these bats, it can get into human population when we come into contact with them, either through contaminated foods that they've been eating, we pick it and we also eat it, then we get it. Then from human to human is just by contact. So anybody who is infected, if one comes into contact with a person through the bodily fluids, you can easily also get it. And as indicated, in Ghana, we have 2 cases and all of them are dead. So basically, we are talking about 100% fatality rate here, but we have quite high fatality rates. It depends mainly on the way the cases are managed, basically. If you don't manage the cases well, anybody who gets it will certainly pass on. So basically, that is how we talk about transmission.
Do we know whether it's an airborne disease or it's not? Because you mentioned contact and then fluids. Do we know whether it's an airborne disease or not?
Oh, no, that has not been established. We don't have evidence to suggest that we can get it through airborne. Basically, we know that it's by contact, that is contact with an infected person. Airborne, I don't have any, I've not read anywhere that we've established that we can get it through airborne. Yeah.
All right, that's fine. Let me quickly dash to Dr. Kwashi and ask, what signs and symptoms would one be seeing if he or she contracted the Marbec virus disease?
I think Dr. Bonnie touched on it. Basically, you would have the fever. You would have this febrile type of symptoms. And then the key sign would be excessive bleeding, either from maybe a wound, or you start noticing that you have blood in your stool, you're vomiting blood or you're coughing up blood. You know, that's a key sign that would be something that would cause you to go to the hospital. Apart from that, a lot of the symptoms, the general symptoms, are similar to other viral diseases. You know, fever being the key one.
All right, interesting. But how long would it take for the disease to manifest if one gets into contact with, you know, someone who has the disease? I'm talking about the incubation period for the disease.
So that could be as much as 21 days. It could be much less, but it could be as much as 21 days. And unlike COVID, for instance, there's no evidence to suggest that you are transmitting before you start to show symptoms. However, because the incubation period is variable, you can't really predict when a person will start showing symptoms. And once a person starts showing symptoms and sweating excessively and all those things, then they are going to be shedding virus.
Now, you mentioned that this is from the family of Ebola. Now, as scientists, how do you differentiate between this disease and Ebola? What's the distinguishing factor?
I mean, the key distinguishing factor is that if you sequence them, they are different. If they have slightly different features, even though they're in the same family, they cause the same type of disease. They are different, you know. So you know that by looking at the features, the sequences, and also looking at the differences in the antibody repertoire, the antibodies that recognize it. But what it also means is you would treat it the same way that you treat Ebola patients, which is with supportive therapy for the most part, which is why Dr. Bonnie mentioned that's really how you manage it is the key thing. So that means that if people have, I didn't mention abdominal pain, I mentioned vomiting, nausea. If people have these symptoms and they see that they have blood, the most important thing is to rush to a health facility and get screened as soon as possible, because that's the only way that you can increase your chance of survival. You know, there's no drugs for this. There's no vaccine as of yet. And so supportive therapy or treating the symptoms is the best way. And it has been shown that with early intervention, survival rates go up.
All right, now let's talk about how contagious the disease is, because COVID-19 taught us with the various variants that we saw that dependent on which variant we were dealing with, the rapidity with which the disease spread was different. And so, Dr. Bonnie, how contagious is this disease we are talking about?
Well, it's highly contagious so long as you come into contact with an infected person. You know, my colleague was talking about how we can easily distinguish the two. Yes, and another easy way is to take it to the lab for them to do a detection. So So even before you do the sequencing, just a normal lab detection can tell the difference between an Ebola sample or an Ebola affected individual and also somebody who has got the Marburg. It is highly infectious as long as you come into contact with somebody who has got it. But you see, the key thing here is because it's contact transmission, it's easy to contain. If you know, or if you have the index case more or less isolated and being managed by people who have got the requisite personal protective equipment, then we are more or less containing the virus. But like Dr. Kwashi said, if we are not quick enough to detect and we have these infected people in the community, then certainly because of the way our cultural practices are, we tend to spread the virus easily. So ideally, if we get to know a person infected and that person is isolated, we tend to contain the virus. But if we don't do that early enough and infected people remains in the community, then we have chances of spreading the virus. So that one is a key thing. But if we talk about contagious, it is highly contagious.
Now, let's talk about the bit about the incubation period, because COVID-19 taught us to know that there are some individuals who may be carriers of the disease and yet will be asymptomatic, would not show any signs of the disease. So the early part of the disease being contracted, can the individual transmit to another individual? And are there cases of people being asymptomatic and yet being, carriers of the disease?
So for this one, let me just say this before even. Yes, we have a range, about 3 weeks incubation period, that's 21 days. It is not like that of COVID, where somebody can be asymptomatic and will be able to. Until you start showing the symptoms, it is difficult for you to start transmitting. So that is one of the key things that we need to know. The initial part is just febrile condition. So if you are to suspect, you don't have to be so quick. When we are dealing with some of these diseases, until we have had a case in the vicinity, where we call it that if you get one case, it's an outbreak, where we call it an outbreak. Anybody in that area, if you start having symptoms, we suspect because we have had a case in your vicinity, or we have confirmed a case in your vicinity. So if that's the case, if you are there and you start showing the flu-like symptoms, headache, your body temperature going up and all that, you quickly have to be seen. Because you see, the earlier you get to the hospital and they start managing, the better. You are increasing your chances of survival. Otherwise, it will now go into the advanced stages and you start the bleeding. And when it gets to that stage, it's difficult for you to come back. So we don't have to rush with the early symptoms. Now that we are talking about it, the moment you start having febrile conditions, you are going to the hospital because you are suspecting a Marburg infection. No, we usually suspect within areas that we know that we have had confirmed cases. There's an outbreak. We say that, please, if you know that you are having this condition, you are in this vicinity, that's why they keep them quarantined for some time. I mean, those who are in those or who came into contact with the infected people. But if you are not there and you start having these conditions, yes, you have to go to hospital, but don't start suspecting that you have Marburg. So basically, the initial symptoms are quite general. You cannot tell easily whether you are getting this, especially when you are not in a zone where we have confirmed cases. But when you are there, then you have to be quick enough to go to the health facility for them to do a proper screening and testing.
Now, you talked about the zones where cases have been reported, but until the reportage of a case to a medical facility, one would not know. For instance, as we are in Accra here, there could be a possibility the individual I came into contact with today might have the disease, and until a test is done, it can never be identified. Now, COVID-19 again taught us that the virus operated within a certain environment. We're told COVID-19 thrives better in cold regions. And so initially, one of the assertions was that for those of us in the warm regions or hot regions, it was going to be difficult for COVID-19 to wreak havoc. In this respect, has Marburg virus any of these characteristics?
Well, you see, so long as we have established or it is known that we have a vector or we have a reservoir in the bats. So if you are in an area where we have this preponderance of these bats, especially in caves or mountainous areas where we have caves or even abandoned mines, those areas where we have these bats going to roost in there, then you should be on high alert, because sometimes you don't know the type of bats. We have so many types of them, but we are talking about one particular one that they have identified these viruses in them. So if you are in those areas, then you start thinking about that. Because you see, it has to move from, it's a zoonotic infection. It has to move from these animals into the human population. But once it's in the human population, then we have the human to human spreading. But once it is not there, then you have to make sure that we suspect if we have had a case around. So that is what I'm saying. So in case you are in an area where we have identified cases, it's not like COVID that we are talking about, temperature. So long as the animal is there and we know that it has a way of transmitting the thing to humans, if we come into contact, you just have to be careful. But then if it is not there, then we can talk about the fact that until a human-to-human infection is established, we cannot talk about maybe cold or, so long as these animals are there, we have to just be careful and make sure that we suspect once we have cases around.
I'm smiling whilst you are lecturing me tonight on this disease, and the thought that's running through my mind whilst I'm smiling is the 37 military hospital where there are lots and lots of bats. I'm also smiling because of people who have fruits in their homes and so do have, you know, some of these fruit bats coming once in a while to enjoy some of these fruits on their trees. In this respect, how do these individuals respond to this threat of Marburg virus, for which 2 cases have been reported?
Right, so like my colleague indicated, if they feed on fruit, so if you see a fruit that has fallen from a tree that has been maybe half bitten or chewed halfway by these, you don't know the insect or you don't know the kind of animals that chewed it, you don't have to go and pick it and start chewing it. See, these are the ways that you can contract the virus. Yes, we have these bats at 37. They've been there for years. I mean, almost all of us came to meet them. That doesn't mean that we are all falling down sick with Marburg. So long as we don't come into contact with these animals. So long as we don't come in. So that again, we talk about people who are handling these animals for meals and all that. That is where the caution comes in. That we have to be very careful when we are dealing with such animals, because they harbor a lot of viruses, not only Marburg, they have other viruses in them. And you can get them when you are in close contact with them. Either you are handling them for a meal or you are hunting them down to sell and all that. They have to be careful. But the mere flying over our heads will not give us a Marburg virus.
Interesting. Dr. Koshi, I'll ask this, and that has to do with the point you made when you were giving us a historical background of this disease. You made the point that it was around 1967 where the first case was reported. One would have thought that over the years, with the advancement in technology, we would have found a vaccine or something to treat this disease. Is it that there isn't much attention being paid to it, or what could explain this?
You hit the nail on the head. Because it's a very rare virus, and it very rarely causes human outbreaks. So really attention hasn't been paid to it. Similar to Ebola, until the West African outbreak, where it was really the first large-scale sustained outbreak sustained over multiple years. There wasn't as much attention paid to Ebola either prior to that 2011 outbreak. So this is the real key thing that has prevented vaccine discovery, or at least any work on looking at convalescent therapy and things like that. One thing I wanted to clarify, and I saw that in some of your the newspaper articles you were referring to, there's a misnomer that people keep using. They're talking about outbreak, but outbreak is a very technical term. We haven't had an outbreak of Marbec in Ghana. We've had the first cases. You see, once you start talking about outbreak, you're talking about infections in the community. You're talking about rapid spread. So I hope you help us to use the right terms.
Terminology.
Yeah, because it means something when you say outbreak.
Okay, that's interesting. Thanks for the education on that. We would look at how we are going to handle ourselves moving forward. Because again, COVID-19 taught us lessons. One, there must be the supply of PPEs. There must be the preparedness of the various medical facilities in terms of quarantine, occupancy spaces. And there must be several other measures that must be put in place now that, we have recorded these two cases, and some 90 people are being, checked to see whether they contracted the disease. We would look at the proactiveness of the Ghana Health Service in this matter, and your expectation as, virologists as to how the Ghana Health Service must handle this matter, especially looking at where they are coming from. We will take a short breather, and then when we come back, we'll look at this angle of the conversation. Do kindly stay with us. And you're live on ETV Ghana, and you're watching Fact Sheet here. It's all about the fact and nothing but the fact. I'm having a conversation tonight with my guest on the Marburg virus, which has already claimed 2 lives, and some 90 people who are being observed at the moment as to whether coming into contact with these individuals would have exposed them to the Marburg virus. So far, we have learned about the symptoms, we have learned about its transmission rate, and we have learned about its history as well. But how proactive have we been, seeing that there had been some reported cases of the disease in our neighboring countries? And what expectations do we have of our health service officers, especially seeing how COVID-19, caused harm and havoc in our country? And so I would start with Dr. Kwashi. Doc, would you say that we have been proactive enough in terms of the handling of, this Marburg disease?
Well, I mean, speaking from afar, what has been reported seems to indicate that the Ghana Health Service is trying to put in place the right processes. The first step is, I would say, doing the test and identifying Marburg virus shows that you are actually looking for the right, you're not just assuming something, you're testing for the right agents. And 2, quarantining people as much contacts as they can in these 2 locations shows that they're proactively trying to cut off the transmissions. Like Dr. Bunny said, the one thing about these hemorrhagic fevers, these viruses, is that unlike COVID, unlike SARS-CoV-2, which is spread just freely because it's contact. Once you can trace all those contacts and you can encircle them, you essentially stop the spread into the community. So far, from what I've seen, it looks like they're on the right track. What's probably may be happening, which I'm not aware of, is really a detailed investigation trying to find out the travel history of these individuals and their contacts. So that's probably something that may be going on in the background. But it looks, sitting from where I'm sitting, like the right things are being done.
All right. Dr. Bonnie, I would throw the question as to what your expectations are as to what the Ghana Health Service or the Ministry of Health must be doing. I remember during the COVID-19 times, we had a situation where even laboratories lacked certain equipment to function well in terms of the cases and specimen that was brought to them. What do you expect, having lessons from the COVID-19 situation? What do you expect them to do?
Right. So truly, like what my colleague said, I think they have been proactive enough. The fact is that we have the capacity in country to detect. You know, in your reportage, we saw that they were saying samples has to be sent to the Senegal Institute for them to confirm. So it's actually not a confirmation they were doing. Actually, it's a quality assurance. I mean, if a lab does something, another lab has the opportunity to more or less give a second opinion on what they've done. So it was actually confirmed in country, and they sent it there for a second opinion. So if you have that capacity to test, that is a very good thing. At the moment, we are not doing active surveillance for the virus. We have collected hospitals, so they do what we call the passive one. They see a case that has got a manifestation of, or that has clinical manifestations of either Marburg, or we talk about Ebola, we got our Lassa, dengue, yellow fever. They belong to a family that we call them the viral hemorrhagic fevers. They quickly suspect, they will pick a sample and send it to mainly Noguchi. Noguchi is the first point of call. So they will do the initial detection and send the message across. So that system is there. So for that one alone, now we give that credit to the health service. And like what Peter Kwatish said, the moment they see anything like that, the first thing is make sure that the contact are traced, the contact are quarantined, and observe them for the period that is stipulated. Then in the course of that, to those close contacts, their samples are taken, we test them and all that. So that system is there. So if you do that, you tend to curtail the spread, and that is a good thing. So from where I also sit, I see that they have been proactive enough and they are doing the right things. And if you do that, it's good for all of us. I mean, we don't panic even if these things are detected. Once the index case or index cases are kept, or I mean held in a place, we know that we are more or less minimizing spread. So I think they are on the right track.
All right, now I am reading from the BBC, and their report suggests that the people who are being contact traced, some of them are medics, some of them are mortuary workers, and some of them are relatives of these patients. Now, my focus is on the medics and then the mortuary workers. In this respect, what do you think should be happening at our medical facilities now?
So it's quite simple. The moment, you see, they always advise that when you see patients, you should have the basic PPE. I mean, if nothing is happening and patients are coming, you should have the basic PPE. Our medics know about some of these conditions. If a patient is seen in an emergency facility and the patient is bleeding all over, I'm not very sure that they will not put on some basic PPEs before they attend to the patient. So you can see that so far we've not had any issue with those two cases from the medics or from the health staff who attended to them. That means I'm suspecting they were properly fitted or kitted. They were wearing the right PPE. So well, that one we will give them. So long as we have not had any incidents or any information to the effect that we have some of them getting the infection, then that means at least they had the right PPEs. So for the medical staff, it is always advised that the basic PPEs should be done when we are attending to patients who come in, no matter what they are bringing in, because every patient who come in probably may have a potential hazardous agent in her or in him before the person comes. So whenever we are dealing with patients like that, we have to have the basic PPEs. So I'm thinking that was done in this case. That is why we are not having any information to the effect that some of these people have also contracted or they are showing symptoms.
Now, you've spoken about how contagious is it, but I want you to make it clear for us. What's the possibility of the situation spiraling out of control? Is that possible?
It is possible if we don't know what is happening initially. So the patients or those infected are being handled in any way. I mean, he handled them in ways that we are not actually ensuring what we call the biosafety or the biosecurity processes, putting those one in place. So it is possible when we allow or we handle them without the proper personal protective equipment. It can get out of hand. I mean, if you should start thinking about what happened in the West African epidemic, the Ebola between 2014 and 2016, when it started, most people didn't know what we were dealing with because it had not happened in West Africa before. So people were handling the cases just as they would handle any other case, either malaria or typhoid or what have you. So people came into contact with individuals who were infected. And these people spread the virus before we got to know that we are dealing with these notorious viruses. So if you have an understanding of what you are dealing with, it helps you to minimize the spread. It is not like COVID, like my brother said, it's not like COVID that is airborne, that even if we keep the persons there, we can easily spread it. This one, the moment you identify and you keep them quarantined or isolated, you tend to minimize the spread, so it cannot spiral, it cannot keep spreading.
All right, I will give the final bye to Dr. Kwashi. Doc, in terms of education as to do's and don'ts, I remember, again, lessons from COVID-19, we were told wash your hands, we were told use hand sanitizer, keep a distance, and all. What would you expect the Ghana Health Service to do with respect to education on this disease?
All right. So I think hopefully the risk communication is going to
well, Doc, I think
up.
your microphone might be muted. If you could check that for us.
Can you hear me? Can you hear me?
Okay, I think I can hear you now.
Okay, so I was saying that I think the risk communication department should really ramp up and look at, in terms of what the public should do, a lot of it is similar to what is being done for COVID. Hand washing is paramount in public because it's contact, but it's also contact with bodily fluids, which means that if someone has spat somewhere or something, that you do have a risk there. So hand washing is one of those things. Also, not when you know that somebody might be, there might be a risk, not excessively touching with strangers and things like that, not handling wild animals, particularly bats. And then one thing that I hope they would focus on is also talking about the dangers of harboring suspected cases. We know that in, I believe, in Guinea, that was one of the big things because people were superstitious. They tended to keep them at home, and then it was spread to the whole family and then the whole village. So that is the major risk that we have. If we hope that these 2 cases are just isolated cases and that's the end of it. But if it is in the community and you have those symptoms, or a family member, somebody you know has those symptoms, it's very important to identify that and confirm that. I think those are the key things that I would say about control. So hand hygiene, personal hygiene is a big way of controlling any infection. And for now, that's the best that can be done until.
All right, Doc.
And then of course,
unfortunately, time is fast spent, and so I'd like to thank you, Dr. Kwashi, for being our guest tonight. I'd like to thank you as well, Dr. Kofi Boni, for also joining us tonight on Fact Sheet, and to thank every one of you who found time and space to watch us on this very informative and educative session, which has to do with the Marbec virus. Again, the old, processes still hold, and they are valid. Wash your hands with soap, use your hand sanitizer, observe the social distance, and avoid contact. These are very, very, very important. So let's observe the COVID-19 protocols, and in observing that, we'll still be keeping ourselves safe from the Marbec virus. Dr. Peter Kojo Kwashi is a Senior Research Fellow, WACBIP, and Dr. Joseph Kofi Boni join us. He's a Senior Research Fellow, Noguchi Memorial Institute for Medical Research, University of Ghana. They join me. And once again, on behalf of the production team, which made it possible for us to have this show, I'd like to thank every one of you for watching us. Have a good evening.